Communication, a useful tool to enhance awareness of the nursing profession. According to the Merriam-Webster Dictionary, a communication is a process by which information is exchanged between individuals through a common system of symbols, signs, or behavior. Communication to our patients, families, and other healthcare professionals is imperative to redefine our image. It is how we conduct ourselves as professionals. Effective communication improves our patient care by influencing a positive nurse-patient relationship. The perception of healthcare quality and a positive patient outcomes will only enhance professional awareness. There are different methods of communication with our patients and families and help define our nursing practice. Various ways to effectively communicate in the nursing profession. Direct versus indirect communication. Verbal versus nonverbal forms, which include initial interactions with patients and families. Bedside report and handoff, nurse-physician rounds, and the use of social media as another form of communication. These ways of communicating are imperative to show the patient, their families, our peers, and providers that nurses are knowledgeable and educated professionals. Direct versus indirect communication. Direct communication in the nursing profession involves speaking to a person face-to-face, using one's own words and voice to have a conversation. In this type of communication, parties are able to evaluate tone and body language to interpret the nature of conversation. Indirect communication in the nursing profession involves using alternative methods of communicating. Consider the example in a hospital setting where the nurse is utilizing a whiteboard in a patient's room. The nurse writes her name and phone number she is carrying so patients, families, and providers are knowledgeable and informed as to who is caring for the patient and can be readily reached when needed. Direct communication is the most effective way to communicate with doctors and patients. It is also a way to analyze both parties' tones and body language, which is a form of nonverbal communication. It is a good way to read someone's body language and determine readily if the communication between parties is respectful or if there is some sort of disrespect. There is a minimal risk of miscommunication regarding the plan of care when communicating directly and face-to-face with another healthcare professional. This type of communication is ideal for discussing any changes in a patient's status regarding care and updating a patient and their family about their plan of care. Patient-family communication. Introductions, verbal and nonverbal. First impressions can influence a person's perception right from the initial interaction. Verbal, a proper introduction including your name and title. Nonverbal, ensuring a badge or name tag is visible with full name and credentials. A smile or a firm handshake or light touch. The most influential way to make a difference and present ourselves in a professional light is to introduce ourselves with our full name and title. For example, hi, my name is Maggie Pierce and I will be your nurse today. I will ensure you get great care today. This provides an initial positive interaction that shows confidence, which in turn builds trust with the patient and family. Nurse-to-nurse communication. Bedside report, a way to ensure a safe and professional handoff. Educate the patient of the overall goal for the day and how the nurse as a knowledgeable professional will ensure a positive patient experience and outcome. The importance of bedside handoff is to ensure excellent patient care. This is the time to let the patient see you exhibit the knowledge in the nursing profession. It is the time to recognize and give professional courtesy to the nurse going home and is a perfect opportunity to include the patient on the plan for the day. Let them know you are a healthcare professional by explaining what you will be doing throughout the day. Let the patient and family know the goals and a brief synopsis of what the day will look like. For example, Mr. Jones, today I'll be hanging your antibiotics twice during my time to ensure we prevent an infection, and we will be getting you out of bed and walking the unit 3 times to prevent any blood clots. I will ensure you are not in any pain by assessing your pain every 4 hours and medicating you as needed. To provider communication. Effective communication between nurse and physician is imperative to patient outcomes. The nurse-physician rounds create a culture of safety. interprofessional teamwork enhances the patient's perception of professionalism. When nurses and physicians round at bedside, it shows a sense of unity to the patient. It portrays a nurse a professional in her field because she works in collaboration with the provider. Furthermore, rounding is also a good time to advocate for the patient to show the patient and the family that the team is working in the patient's best interest. The patients hear the plan of care from both entities and is more efficient way to care for the patient and family, which can only improve the public's perception of their care. Social media is an important communication tool. Social media is another effective way to communicate and increase the public's knowledge of the nursing profession. Part of the nursing image is growing as a profession. Social media helps nurses cultivate a professional image by allowing them to voice their knowledge in the healthcare field. Besides the 3 types of face-to-face communication that we discussed earlier, another important tool that can help nurses bring awareness about their profession is communicating through social media. Using the internet and YouTube in a professional manner could facilitate nurses to communicate to the public. The public, which also includes patients, families, and the nurses that take care of everyday and many facets of healthcare. So addressing the public through social media with knowledgeable information to educate and teach the population, this in turn will help reinforce nursing as a trusted profession. Nurses could offer education through published journal articles and as a result to help the change and the image of nursing. Communication via social media, an important tool to stay ahead of healthcare advancements and changes, can provide information to the public, which includes patients, families, and their communities about healthcare programs and the opportunities to enhance their awareness of the importance of the nursing profession. Advocating through social media. One of the nurse's main role is to advocate for their patients, however, sometimes they fall short advocating for themselves. Nurses are not just caring people, they are well educated, they deserve recognition for their profession, and despite great developments in the nursing profession, nurses are not recognized for the skills they possess. Nowadays, nurses choose to further their education as nurses continue to want to expand the knowledge in their profession. Nurses can expand their education through bachelor's, master's, and doctoral programs. They use evidence-based practice in their everyday research to ensure that they are given the best care possible and are doing the safe and best thing for their patients. They are not just patients at bedside, they are part of the healthcare team, which includes a physician. The nursing profession also has evolved over time, with nurses enhancing their education and using critical thinking to do more than just hold a patient's hand. Communication is vital in the nursing profession. Nurses are the front line for ensuring superior nursing care. It is imperative for patients and their families, as well as the physicians, to know the nurse providing excellent care based on evidence-based practice. Clear and concise communication will only enhance the patient's perception of the nursing profession. Excellent care in facets of nursing will enhance nursing as a profession. Patients will then see the well-educated, knowledgeable professional at the bedside or in their community. Effective communication with patients, families, peers, and other healthcare professionals, whether it be direct communication, indirect communication, or communication via social media, will only help to define the nursing practice. Part of changing the image of nursing is growing by individuals and using professionalism and education to increase the public's perception of nursing. References.